Okay, so welcome to our ThermiVA Q&A. This is a topic I'm really excited to talk about, and once we announced that we were going to be talking about this on Facebook, we invited patients and others to submit questions. So I'm literally just going to go through the questions because we've received so many good ones, and this will be a great way to introduce what this technology is. So a good question, first of all, what is ThermiVA? So ThermiVA is a radio frequency technology that delivers heat to the surface and helps generate collagen. This is what the probe looks like. It's a wand with a small area where that radio frequency energy is delivered. How this technology was first FDA approved was for tightening the skin of the neck and the lower face. And then the company, once they realized that they had a technology that could actually tighten collagen, they expanded this to be used on the surface of the skin and as well as intravaginally and on the external surface of the labia minora and labia majora. So it's a non-ablative treatment, stimulates collagen. There's no downtime with the treatment. People can resume normal activities immediately after, including intercourse. You can use tampons. There's no downtime. The next question that I have here is the treatment painful? It's not painful at all. It feels warm. You feel kind of the warmth being delivered, but not in an uncomfortable kind of way. Yes, it's a little bit strange to have a conversation with someone while there's a probe intravaginally for a half an hour to 45 minutes, but usually after the first couple minutes, patients are able to relax, and we usually just have a good conversation. We also have Netflix available on an iPad if you prefer to just watch a movie while you're having it done, but it's very well tolerated, nothing uncomfortable, nothing painful. The third question is, what concerns does the treatment address? So it's made to address laxity specifically. It also can help with low-grade incontinence. It can help with sensation. It can help with lubrication. Basically all of those things. So what we can see is we can see the changes on the external skin. So we can see how it's tightening the skin of the labia. What we know from the technology is the same thing is happening intravaginally as well. And those are the improvements that we see. Another question, how many treatments will I need? The treatment is designed to be done 3 times over a 3-month period of time. So once a month for 3 months. And then with a maintenance treatment once a year. And we've been doing this for the last 2+ years, and that seems to be enough. There's no one who requires more than that once a year maintenance treatment. How long do the results last? So we know that they're lasting at least a year, that people are feeling good after the treatments, at least up to that 1-year mark. And the goal is just to keep that collagen stimulated, to keep those surfaces producing as much collagen as possible, and that's the reason for the maintenance, because unfortunately we keep aging, so all the things that cause a problem in the first place are still happening over time, and that's why we have to maintain it with a yearly treatment. I love this question. One of the questions is, have I had this treatment? Yes, I have. I have, and almost everybody in the office has had their series of 3 as well as their yearly maintenance. So it's something that we all believe in and we've all enjoyed the benefits of, and we're all happy to share our personal experiences with you about our treatments. When do people start noticing results from the treatment? Most people actually do notice a change the day of the treatment. Unfortunately, this is related to the swelling from the heat that's delivered at the treatment. So that lasts for about 24 to 48 hours. The good news is that if you notice that improvement at that time, then you're likely to continue to see ongoing improvement. Once that swelling goes away, that improvement does dissipate until about the 3 or 4 week mark, and that's when people start to notice the benefit of the treatment. Usually that benefit increases over time. So if you receive a little bit of benefit from the first time, then we're very optimistic that you're just going to see ongoing improvement with the second and the third treatment. What's the difference between the ThermiVA and the Mona Lisa? That's a great question. There's a lot of technology on the market, and whether we're talking about vaginal rejuvenation or lasers or resurfacing, there's a lot of different companies that make variations of certain types of treatments. The Mona Lisa is different in that it uses a CO2 laser to resurface the internal surface of the vaginal wall. So the difference there is that there is downtime because you're actually ablating that tissue. The complication rates are higher because of tissue ablation, and that there is significant downtime with the Mona Lisa. Risks of this treatment. So far, amongst all the providers who are doing this, there have been no complications with this treatment. Worst case scenario is that a patient doesn't find benefit from the treatment, and I'll tell you in our practice we have had 2 patients that did not have any benefit. So it's not 100%, but the vast majority of patients are seeing improvement. And I'm just going to ask Ashley if we had any live questions. So no live questions, but thank you very much for joining us. If you have any questions about ThermiVA, you can always email us at info@hollandplasticsurgery.com, or come to our website at Holland Plastic Surgery. So we look forward to answering more questions in the future. Thanks for joining us.